A neonate has persistent jaundice beyond 2 weeks. What is the likely cause? Options are A. Breast milk jaundice, B. Hemolytic disease, C. Biliary atresia, D. Sepsis. The answer is C. Biliary atresia. Persistent jaundice beyond 2 weeks should raise suspicion for biliary atresia, a condition requiring early surgical intervention. Biliary atresia is a rare life-threatening disease that occurs when the bile ducts in an infant's liver and gallbladder are blocked. Public spots are seen in which disease? Options are A. Rubella, B. Measles, C. Mumps, D. Varicella. The answer is B. Measles. Measles is an acute viral respiratory illness. It is characterized by fever as high as 105 degree Fahrenheit and malaise, and cough, coryza, and conjunctiva. These are known as 3Cs in measles. Then, Koplik spots are seen in measles, which is usually table salt like crystals, which are very small and white lesions on the buccal mucosa. A newborn has a birth weight of 3.2 kg. What should the expected weight be at 1 year? Options are A 6.4 kg, option B 9.6 kg, option C 8 kg, option D 10.5 kg. The answer is B 9.6 kg. A newborn's weight typically triples by the age of 1. So 3.2 into 3, the expected weight at the age of 1 is 9.6 kg. What is the most common cause of preventable blindness in children worldwide? Options are A. Cataract, B. Vitamin A deficiency, C. Glaucoma, D. Retinopathy of prematurity. The answer is B. Vitamin A deficiency. Vitamin A deficiency causes xerophthalmia and is a leading cause of preventable blindness in children. What is the first line treatment for scabies in children? Options are A. Benzyl benzoate, B. Permethrin 5% cream, C. Sulfur ointment, D. Oral ivermectin. Answer is B. Permethrin 5% cream, which is safe and effective for treating scabies in children. What is the most common congenital heart defect? Options are A. Ventricular septal defect, B. Atrial septal defect, C. Patent ductus arteriosus, D. Tetralogiophalate. Answer is A. Ventricular septal defect, which is the most common congenital heart defect causing shunting of blood between the ventricles. Which test confirms the diagnosis of cystic fibrosis? Options are A. Chest X-ray, B. Serum albumin, C. Sweat chloride test, D. Pulmonary function test. Answer is C. Sweat chloride test. The elevated sweat chloride level, that is more than 60 millimoles per liter, are diagnostics of cystic fibrosis, which is a golden standard test for cystic fibrosis. What is the primary symptom of pyloric stenosis? Options are A. Bloody diarrhea, B. Projectile vomiting, C. Abdominal distension, D. Failure to pass meconium. The answer is B. Projectile vomiting. Pyloric stenosis is characterized by non-bilious projectile vomiting and a palpable olive-shaped mass. Which condition presents with a barking cough and inspiratory stridor? Options are A. Epiglottitis, B. Croup, C. Bronchiolitis, D. Foreign body aspiration. The answer is B. Croup. Croup is characterized by a barking cough, stridor, and respiratory distress due to inflammation of the larynx and trachea. The most common cause of pneumonia in children under 5 years is options are A. Streptococcus pneumoniae, B. Mycobacterium tuberculosis, C. Klebsiella pneumoniae, D. Staphylococcus aureus. The answer is A. Streptococcus pneumoniae. Streptococcus pneumoniae is the leading cause of bacterial pneumonia in children under 5 years. The recommended method for calculating drug doses in children is based on options are A. Weight, B. Age, C. Body surface area, D. BMI. Answer is C. Body surface area or BSA, which is the most accurate method for calculating pediatric drug doses. What is the leading cause of death in children under 5 years in developing countries? Options are A. Malaria, B. Diarrhea, C. Pneumonia, D. Malnutrition. The answer is C. Pneumonia is the leading cause of under 5 mortality, particularly in low income settings. A child with rheumatic fever should be monitored for which complication? Options are A. Carditis, B. Arthritis, C. Glomerulonephritis, D. Chorea. Answer is A. Carditis. Rheumatic fever can cause carditis, leading to valvular heart disease if it is untreated. Which condition is associated with a whooping sound during coughing? Options are A. Bronchitis, B. Pertussis, C. Tuberculosis, D. Croup. Answer is B. Pertussis. Pertussis or whooping cough is caused by Bordetella pertussis, leading to characteristic whooping cough. Which is the best indicator of severe malnutrition in children? Options are A. Weight for height, B. Weight for age, C. Height for age, D. Head circumferences. Answer is A. Weight for height, which is an indicates acute malnutrition or wasting, which is the best indicator of severe malnutrition. Weight for height. What is the most common cause of diarrhea in children? Options are A. E. coli, B. Rotavirus, C. Salmonella, D. Giardia. Answer is B. Rotavirus. Rotavirus is the leading cause of diarrhea in children worldwide. Which condition is commonly associated with Down syndrome? Options are A. Hydrocephalus, B. Congenital heart defects, C. Spina bifida, D. Muscular dystrophy. Answer is B. Congenital heart defect. About 50% of children with Down syndrome have congenital heart defects, particularly atrioventricular septal defects. What is the hallmark feature of nephrotic syndrome in children? Options are A. Proteinuria, B. Hematuria, C. Hypertension, D. Hyperkalemia. Answer is A. Proteinuria. Massive proteinuria is the key feature of nephrotic syndrome, along with hypoalbuminemia and edema. Which condition is commonly associated with scissoring of the legs in infants? Options are A. Spina bifida, B. Cerebral palsy, C. Muscular dystrophy, D. Hydrocephalus. Answer is B. Cerebral palsy. Spastic cerebral palsy often causes scissoring of the legs due to increased muscle tone. What is the most common type of cerebral palsy? Options are A. Spastic, B. Ataxic, C. Dyskinetic, D. Hypotonic. Answer is A. Spastic. Spastic cerebral palsy, characterized by hypertonicity, is the most common type, accounting for about 70 to 80% of cases. What is the common causative organism of bronchiolitis in infants? Options are A. Adenovirus, B. Respiratory syncytial virus, C. Influenza virus, D. Parainfluenza virus. Answer is B. Respiratory syncytial virus or RSV, which is a leading cause of bronchiolitis in infants and young children. What is the most common cause of preventable mental retardation in children? Options are A. Congenital hypothyroidism, B. Cerebral palsy, C. Down syndrome, D. Kernicterus. Answer is congenital hypothyroidism. Early diagnosis and treatment of congenital hypothyroidism can prevent mental retardation. Which electrolyte imbalance is common in refeeding syndrome? Options are A. Hyperkalemia, B. Hypophosphatemia, C. Hypernatremia, D. Hypocalcemia. Answer is B. Hypophosphatemia, which is a hallmark of refeeding syndrome due to rapid cellular uptake of phosphate. Apart from this, refeeding syndrome is characterized by other electrolyte imbalance, particularly hypokalemia, hypomagnesemia, and thiamine deficiency. What is the cause of TED spells in tetralogy of Fallot? Options are A. Dehydration, B. Decreased pulmonary blood flow, C. Hypovolemia, D. Increased oxygen saturation. Answer is B. Decreased pulmonary blood flow. TED spells occurs due to a sudden increase in right to left shunting, which causes reducing in pulmonary blood flow. Infants have acute episode of cyanosis, or which is known as hypercyanotic spells or blue spells in tetralogy of Fallot, and which is during the period of crying, feeding, and defecating. So knee chest position is always recommended if the child experiences TED spells. What is the normal respiratory rate in a newborn? Options are A. 10 to 20 breaths per minute, B. 30 to 60 breaths per minute, C. 15 to 25 breaths per minute, D. 40 to 80 breaths per minute. Answer is B. 30 to 60 breaths per minute. Newborns normally breathe at a rate of 30 to 60 breaths per minute. What is the therapeutic management for pyloric stenosis? Options are A. Gastric lavage, B. Nissen's fundoplication, C. Pyloromyotomy, D. Nasogastric suction. Answer is C. Pyloromyotomy. Pyloromyotomy, which is a surgical splitting of the pyloric muscle, is a definitive treatment for pyloric stenosis. A child with Down syndrome is more prone to which congenital heart defect? Options are A. Tetralogy of Fallot, B. Ventricular septal defect, C. Atrioventricular septal defect, D. Coarctation of aorta. Answer is C. Atrioventricular septal defect. Down syndrome is strongly associated with AV septal defects. What is the most common cause of pediatric cardiac arrest? Options are A. Hypovolemia, B. Hypoxia, C. Arrhythmia, D. Trauma. Answer is B. Hypoxia, which is the primary cause of cardiac arrest in children due to respiratory failure or asphyxia.